Good morning, everyone. Welcome to the panel this morning on Monday. We're delighted that so many people are here, and we look forward very much to hearing people's views. We've got a star-struck panel, and stars indeed. We've got three people who are going to present to us this morning about the power of caring, and I'm delighted that they've joined us, and they're looking forward to sharing their ideas with you and also to debating their ideas with each other. So I'm sure you've seen on the programme that the people we've got have been often very closely associated with the Sustainable Care Project. We've got Rob Anderson, who's chair of the advisory group, and Rob was the former head of social policy of the Social Policies Unit at Eurofund, and before that he was nearly for 20 years their research manager, and has also worked at the World Health Organization, and I think most particularly germane to this morning, he was president of Eurocarers for many years. So welcome to Rob. Our second speaker is Alyson Scurfield, who'll be well known to very many people. She, in her role as Chief Executive of the TSA, that's the representative body for technology-enabled care services. And I'm sure you'll know that their website gives a deal of information about this. It's a membership-based organisation, and they're very interested in all of the work that we're doing around care providers, carers, and people in receipt of care services. And then last, but by no means least, is Madeleine Starr, MBE, who joined Carers UK over 20 years ago in 2000. She then joined to lead on carers and employment. And I suppose little did we think that that issue would rise to such prominence today. But in addition to leading on that, she's also a member of Carers UK senior management team and director of Impact, business development and innovation. So there can't really be much else to do, can there, if you've got all that under your wing? But we very much look forward to hearing from Madeleine, who's been such a champion of the Sustainable Care Programme, but more importantly, of carer support nationally and internationally over many years. So I'm Jill Manthorpe from King's College London, and I'm delighted to be here in my role as a member of the Sustainable Care Programme, but also as a person who runs a policy research unit on the health and social care workforce. And we all know that workforce is moving centre stage in social care, quite rightly. It always is centre stage in health, but it needs to be centre stage in social care debates. And we hope that in the forthcoming Queen's speech, the social care workforce will be recognised for what it's done during the pandemic, but more importantly, recognised for what it does every day, every moment of the day and night as well, in supporting people who need social care and sometimes supporting carers very effectively too. So hopefully we'll bring all those themes together. I'm going to start, as I mentioned, by inviting Rob Anderson to come and join us to talk about his perspective on the world, and particularly around the power of carers and voice. And we very much look forward to hearing from you, Rob. Rob's going first with a brief presentation, and I hope that will stimulate a lot of ideas and questions, which will be available for you to enter in the chat, as I'm sure everybody is getting a little bit used to nowadays. So good morning, Rob. Over to you. It's very great that you're here, and we very much look forward to hearing from you.
Thank you, Jill. Good morning, everyone. I'm delighted to be here, and I hope we can follow on what was a terrific first session. My intention is to make a short contribution in two parts, one looking at the nature of good evidence, and the second in considering the impact or power of that evidence. Last year, we all experienced a very illuminating period of science and politics together. Perhaps we witnessed some rebounding in the general reputation of experts and also in respect for evidence. Evidence has driven policies and practices, but we've seen an uneven response from governments, both in timing and in interpretation. The science has been followed, but also ignored, and in some cases, recently, preempted track and trace, lockdown, the risks of vaccination. The science or the good evidence has been taken up or otherwise in the context of previous experience, current politics, economic circumstances, institutional developments, and so on. What constitutes good evidence in relation to care? Well, I take the view that this includes diverse forms of systematic research involving an organized approach to gathering knowledge. This embraces academic research, including particularly the evaluation of what works and how, but also the expertise of people working in health, social care, and related fields, as well as the lived experience of care providers, paid workers, and unpaid carers, as well as recipients or users of care. The evidence may be good insofar as it has been collected systematically and satisfies criteria for robust data. The evidence is likely to be stronger if it incorporates different approaches and perspectives, enabling more integrated insights. From the perspective of academic research, we all know there are well-established principles for scientific quality, for valid and reliable evidence, underlying not only the data we collect in surveys, but also case studies and qualitative research. The contribution of evaluation, what works and how, is very important, and a range of tools and approaches are developed in this field, as Jill well knows, for policy and practice evaluation. But we might argue that they are not built in routinely to policy and practice innovation or development as much as we think is needed. Fundamentally, good evidence to inform policy and practice calls for clear definitions and concepts. If we want to measure care and the contribution of carers, we need to establish what and who it is about. There may be different concepts applicable for different purposes. However, a recent article by Aviad Tursinai and colleagues, 2020, has demonstrated how difficult it's been to estimate even the numbers of informal carers in Europe. The definition or concept of informal carer, if any, has been adopted by different institutions in different ways, whether it's WHO, OECD, UN, or so on. And the concept has generally been rather vague. While in the scientific community, studies differ significantly in definitions, as well as the methods used to measure the contributions and characteristics of carers. Unpaid, yes, but voluntary as well as family care? How frequently do carers need to provide care to be regarded or identified as carers? For how long should they have been providing care? What tasks are they undertaking and who is being cared for? All of these may be different in different studies and questions about carers. And the same could be said for the definition or concept of care worker. Not surprisingly, in the Aviad Tursinai article, results for individual countries are very different in different surveys. They look at the European Quality of Life Survey, European Health Interview Survey, and SHARE, and find individual countries with different proportions up to 20% different, particularly in the countries of Western Europe. As the authors say, under such circumstances, evidence-based policymaking becomes rather difficult. Adequate data were lacking, particularly for older age groups. but we all know that the numbers of carers are essential to inform and plan policies. We also need more information on the characteristics of carers. Good evidence should be more than numbers alone, but also insight and intelligence, drawing upon relevant analyses of the data. Again, demanding well-defined concepts and analytical frameworks. Good evidence will help policymakers to better articulate questions and emerging issues, as well as guiding answers or solutions. Documenting and analysing change over time, trends and developments is particularly useful, so helping to assess relevance and impact of policies. Needs and circumstances do change. Repeated or regular national and international surveys of carers have contradicted the myth of the declining contribution of informal care, as well as making the costs of informal care more visible. However, promoting the results of research isn't equivalent to providing messages to inform policy. Researchers have privileged knowledge and understanding of their data and of the experiences of their subjects, carers, and people being cared for. They should, as far as possible, be drawing upon this to orient or shape ideas for policy and practice. Left alone, data can be directed to all sorts of messages, or to none at all. The power or impact of research, of good evidence, depends upon the clarity of the main messages and the quality of communication, but evidently also a host of other factors. Evidence is part of a decision-making process, alongside politics and values, infrastructure and economics. As Simon Bottery from the King's Fund said last week, social care reforms demand more than winning the argument. The quality of life of people with disabilities and their carers may not rank high on the agenda of policy and policymakers, or at least not at this time. Proposals for action may be regarded as expensive, time-consuming, or otherwise difficult to translate into practice. Prospects for application of the lessons from research are likely to be better where there is effective advocacy or campaigning organisations, and more generally where there is good communication, conversation and dialogue between researchers and policymakers, practitioners and people experiencing use or provision of care. I'm aware that recognition of the importance of working together to translate evidence into practice underpins the strategy of the new Centre for Adult Social Care, Impact, Improving Adult Care Together. This aims to lead the way in making better use of high quality, practice-based evidence to support innovation in social care. But the Centre also explicitly aims to improve our understanding of what helps or hinders when putting evidence into practice. Finally, the history of implementing good evidence in policy and practice is obviously a long one, but obviously also slow and demanding. Again last week at the conference, Helen Walker from Carers UK reflected on their long-standing commitment to apply evidence from sound research to their campaigns. As many of you know, the forerunner of Carers UK, the National Council for the Single Woman and Her Dependents, was established in 1965, more than 55 years ago. Fewer of you will know that already in 1974, so more than 45 years ago, the British Medical Journal published an editorial arguing that, and I quote, "the work of carers is not sufficiently understood or supported." And perhaps only two of us know that 35 years ago, I wrote an editorial for the BMJ on the, quotes, "unremitting burden on carers." This made several of the points about research that I've repeated today. I quote, "Studies are difficult to compare because they have different samples and designs, define carers in various ways, differ in how they measure stress, and lack multivariate analysis. We should study more the quality of life and suffering of carers, and not just whether they have clinical indicators of stress." Nevertheless, many of the main needs of carers 35 years ago have been identified. They want recognition of their work, planned respite care and free time, information about both disabilities and services, practical help, and money. Carers also need continuity of support, which will help them respond to changing circumstances and prevent the feeling of abandonment. The editorial from 1987 concludes, "The need for much improved coordination of support has been evident for decades, and look what has happened. We continue to need support for collection of evidence from diverse sources and for initiatives like Impact to strengthen the power of our good evidence." Thank you very much.
Good, and thank you, Rob, and what a thoughtful comment that was. We sometimes think that things are being invented again, and you pointed to not only a one generational time in which people have been talking about things, but perhaps two generations, that carers' needs, wishes, priorities, and indeed strengths have been the subject of research. So I thought that I learned a lot from that, not only that I must go back and look at that editorial, Rob, but also to focus my mind that sometimes we need to explore questions as well as answers, and indeed that perhaps there's something around policy-based evidence as well as evidence-based policy, in that we often talk about policy in a very, very general way rather than being clear on what policies we're referring to and indeed what policies we would seek to change. So very many thanks for that. A nice history lesson for those of us who like to obsess about history, but also a history of research as well as thinking about how contemporary some of those questions remain. I want to see if there's got any, I'm not going to ask questions at the moment, but if you have got questions for Rob, please pop them in the chat so you don't lose that, because we're going to turn to our second speaker. And I've already introduced Alyson Scurfield. I know she'll have much to say about power and voice, and I'm really looking forward to hearing from her. And we'd like to thank her so much for joining us today from what is going to be her busy schedule this week, as indeed I'm sure all weeks are at the moment. So warm welcome to you, Alyson, and we very much look forward to hearing from you.
Thank you, Jill, and I'm delighted to be here today, but generally I'm delighted that TSA are very closely aligned with the Sustainable Care Programme. So Jill's explained that I'm the Chief Exec of the national body, Tech Services Association, but also I'm actively involved as a trustee in the International Longevity Centre, which is our national think tank on longevity and aging. And I keep myself and my vision firmly wedded into communities and delivering services as a trustee of Age UK North. But most importantly for today is with my national and my international work, I'm a carer for my dad who's 83. So really relevant, everything that we say from Rob there. And I'm delighted to be on the panel. Rob so clearly articulated the power of evidence and the impact of how we change the way we live our lives. But I'm delighted that I'm going to also be followed by Madeleine Starr, who is a non-executive director of TSA. And Madeleine and I go back a long way in terms of what we see as our aligned vision for good care. So let me just, I think today my title was The Power of Technology, but I would like to turn that on its head and say the power of people. So let's just have a look at what is TSA. It is the national advisory body. So everything from lobbying government through to supporting services in the community and technology solution providers. But our vision is about people's everyday lives enriched and enhanced by technology. And you'll notice there that technology isn't the driver, it's people. And the mission of our organisation is to drive transformation of the sector through strengthening partnerships, data and people, and ensuring quality and safety of tech. What I would like to bring to today's discussion is real life stories. So a little bit about how we're going to build back better after the year we've had, which shone a light on technology-enabled care services and how we live our private lives, professional lives, and how we deliver services. It's been a really difficult year, hasn't it, for us all? And we've seen the toughest times in health and care we've ever known. We've seen our workforces shoulder a greater weight. Our systems have been unrecognisably having to adapt to new ways of working. And we've all experienced loss, whether that be human loss, between our teams, with the people that we serve. I've been part of the battle from the get-go when we got our first lockdown from Boris last year, with 1.8 million service users out there and over 370 organisations. We had to really adapt quickly in TSA to support that whole infrastructure. So being part of that battle and working to maintain valuable services, I'm incredibly aware of the things that we didn't lose. We never lost our drive to do the best for the people that we serve, whether that be in a caring capacity or delivering the services. And we never lost our grit and resilience, even when things seemed absolutely impossible. But the one thing all of us have had, whether we're as an informal carer, whether it's in my capacity of lobbying government or supporting the same delivery of services, we never lost hope. And the stories and voices that I've heard during the pandemic in our conference a few weeks ago are quite incredible. We've never lost hope of the new ways of working, on the new ways of thinking, but more importantly, proactivity and prevention. So during COVID, we were commissioned by the Department of Health to firstly look at resilience out in those communities to keep those services going and supporting informal carers. And it was quite incredible in the first few months. But what we did see is newer services were emerging across the country to deliver personalisation, which we've talked about a lot when we think about personalised services in the communities. We should all have the opportunity to live meaningful lives, doing the things we enjoy in communities we call home, with the people that we love. It's vital to you and I, to our own health and well-being, and we've seen that over the last 12 months. But individuals who are older, who have learning disabilities, mental health needs or physical needs, and their carers and their informal networks want exactly the same, and our role is to enable them to achieve these aspirations. So technology gives us the power. As Rob's just described, data, people and partnerships are the essence to really make a difference in people's lives. Proactive services were developed in partnerships, offering place-based services in communities with real strong outcomes for people. And I'd just like to set the scene for the discussion today about a couple of services that really shone a light for me. So during COVID, Delta Wellbeing in Wales led the way on shielding outreach, and they connected to 18,500 people in the communities offering that wraparound support, medication, food. The majority of services went straight into contact centres, but they weren't as successful as we've seen in Carmarthenshire, who contacted every single vulnerable person in their neighbourhoods. Dawn, who was 42 years of age, wasn't somebody that would have normally been a typical user of service out in the communities, but she was self-isolating, she had no contact with her daughter, there was a servant police officer frontline, she was a victim of domestic violence, she had multiple long-term conditions and suicidal tendencies and depression. So quickly at the get-go in Carmarthenshire, they started delivering community referrals, preventative outcomes. They issued Dawn with a tablet to keep contact with loved ones and professionals. And this service has grown and grown during not just the first phase, but as we've come out of the latter phases of COVID. And it's grown to 14,000 service users really seeing some value from the services in the community. But what's quite incredible about this is outcomes for people, but also pre-COVID, only 7% of referrals into that service were stopped from going on to more formal services in social care or health. During COVID, that peaked at 41%. So you can see the impact of delivering bespoke wraparound services with partners. And now it's stabilised at 33%, which is incredible. But what we did see in Carmarthenshire was people want to pay for these services, whether it be the informal carer, because they can see the value of proactive and preventative services in the community enabled by tech, or whether it be the actual service user themselves. And their vision in Carmarthenshire is quite incredible. They're moving now into telehealth. So connecting with their GPs and connecting through a telehealth service. And then another example of Madeleine, and both Madeleine and I work a lot with Hampshire and the colleagues down there, Mark Allen and Steve Carethel. But these guys are quite incredible in terms of having a problem to solve, and then how can technology help solve that problem. In Hampshire, 53,000 people were shielding on their registers, and within 2 weeks, they really knew that this was never going to be solved by a traditional call centre with call centre operators. So they then designed a service of reducing social isolation to teams, supporting social and physical and mental health in the communities. And the services included health and social care. Time was critical. We all knew that, and lots of technology was engaged, whether it be video conferencing or whatever we did in our private lives as carers and for delivering services to those most vulnerable. But within 3 weeks, Hampshire were delivering a wellbeing automated call system using AI, and it was introduced to enhance rather than replace physical people in human contact. The service has now been mainstreamed in Hampshire, and a real focus around people in the communities. 2.1% of people are being transferred into a one-to-one support by a social worker or other people in the formal system. But the satisfaction from the people using these services is fabulous. And the WAC system could traffic into the contact centre 97.9%. I would never have thought of contacting or the vulnerable people really wanting to engage with these service provisions. And Hampshire had the strongest leadership embedded to tackle a problem and then solving it with technology. It's not technology for technology's sake. So over the period of time, we started to pull together what we have called a proactive and preventative tech model. And that is putting the service user at the heart and centre and their carers of everything we do, ensuring we focus on key outcomes for people, what they want and what they need. Of course, meeting people's needs is really important, but outcomes to live a fulfilled and happy life is just as important as meeting their needs. And engaging in community signposting, improved well-being and living independently is vital in terms of our new service models that we've been developing over the last 12 months. And when looking at outcomes for people, it's incredibly important that relevant services wrap around the individual to deliver quality outcomes for them and their carers. And our new model looks at proactive outreach, health monitoring and prevention services. In driving these quality outcomes, there's never been a more critical time to demonstrate the powerful use of data, people and partnerships, and finally those key enablers that can make it successful. What we learned prior to COVID was data. We have loads of data, but it's intelligent data, and it's making sure that we use the data to give positive impacts for people. And the key enablers of our new model is looking at governance, organisation, resourcing and enabling technologies. But I'd just like to finish on a piece of work that we've been doing with ADAS, which really relates to this agenda that we're going to talk about today. It was a commission that started last September. So we brought some key officials from ADAS, trustees, our chair and ex-minister, Paul Burstow, Sir David Pearson, who's been leading the task force for social care. We've engaged with lots of different people in the community and engaged with service users and their carers. And the vision for this piece of work, which was launched a few weeks ago, was adult social care must be shaped around individuals, putting power into the hands so they can choose and control the support that they would want to maintain their own well-being and health. Technology can enable this, and empowering families and communities to network and ensuring care and support is joined up, which is preventative, responsive and tailored to people's needs. And this is where I talk about my vision and my hope as a caregiver and an informal caregiver for my dad. He's had mixed vascular dementia and mixed Parkinson's, and he's palliative. He's just been registered blind, but he's used technology for the last 8 years, from everything from the onset of dementia. But where we lack is where the coordination of care and support in the community. I personally described at the beginning of the ADAS work as the system was broken in Newcastle. And the frontline social care and district nursing staff that just don't have the insight and the tools to truly deliver that personalised care that I would like to see for my mum and my dad, which is really relevant to this discussion. So what does our implementation plan look like to government and policymakers? How can we take the agenda forward with a personalised approach to care and support in our communities? Our work over the next 6 to 9 months will be a bottom-up approach and work with people and practitioners in communities to capture effective services and technologies and what they really want. I think we look at services, we look at technology, but there isn't a lot of work out there where we really engage with people. And the second phase over the next 6 to 12 months is a top-down approach and build a business case to use regional data to confirm needs and how technologies can be embedded into care. TS and ADAS are currently working with senior officials in the department to shape the business case over the coming months. As we all know, the budget wasn't good. It was disappointing how much support was there for social care. And the focus of this programme is strategically shape the next spending review for 2022. So our ambition to create the Carmarthen Shires, the Hampshires, but it be universal across the whole of England and beyond, is to create and get funding for implementation of personalised care and innovation programme in 7 to 10 regions across England. Now, we've seen it as vanguards in health, but we need this investment in social care. And the phase 4 would be to deploy that learning nationally across England. I would like to conclude before we go into discussions and hear from Madeleine, because I know she'll chime with some of my messages, is to finally say that TSA is really committed to making a difference, to transforming lives for all, whether that be carers, individuals, professionals, because it's all people and partnerships that will really enhance people's lives as we move into the future. Thank you.
Thank you, Alyson. That was really interesting, and particularly to hear about your current work. Also, I think making some links to what Rob was saying, 35, 55 years ago when carers were being discovered, there was massive technology rollout, wasn't there? That was the time when there was a real push for older people to be given phones. And I think for many of today's older people, the advent of a phone into their life really was the technological change, coupled, of course, with real technology in terms of central heating and in terms of fridges, which again are the undersung pieces of technology and kit that we take for granted, but for many older people, those were revolutionary, and they have seen the implementation, because there were national schemes there, of all these technological advantages which changed their lives from those of their forefathers and mothers. So we're going to move on to talk to Madeleine. There's some questions coming in already, so we're hoping that we'll reach those very shortly. But over to Madeleine, I think, as our third final speaker this morning, to reflect on power, particularly around carers. And there's probably nobody better equipped than Madeleine to make these comments. So over to you, Madeleine.
Thanks so much, Jill. I'd just like to begin by saying what a very real pleasure it is to be here today among so many familiar faces, certainly faces on the panel, names for the rest, so names at least, who I've worked with over the years. Sustainable care is the culmination of many years of work with Professor Sue Yendall and colleagues nationally and internationally, and it is a collaboration that Carers UK values very highly. So I want to begin with a carer. Rob referred to the National Council for the Single Woman and Her Dependents, which eventually became Carers UK. What you may not know is that it began with the voice of a carer. The Reverend Mary Webster had forgone a married life and a family to follow her vocation as a congregational minister, but in 1954, age 31, she found herself as a single daughter, having to give up that vocation to follow the well-trodden path of so many women at that time in providing care for her elderly parents. She then faced the stark reality still experienced by carers today of trying to manage that care while dealing with the financial hardship that loss of income brings and the prospect of poverty in her own old age, to say nothing of the loss of her professional identity, which was very dear to her. What is remarkable about Mary Webster is that nearly 10 years later, living in a situation she described as house arrest, she took what had always been perceived as a private and personal matter, the issue of care, and moved it firmly into the public domain. She wrote to the national press asking if there were other women in her situation experiencing the same impacts of caring, something we still do year on year at Carers UK today. And she received a flood of letters in response, the 60s equivalent of trending on Twitter. And the strength of feeling of these other women and the political savvy of Mary Webster, which saw her gain influential public support, led to the establishment of the National Council, which after several incarnations became Carers UK, whose work has been the foundation of the carers movement in the UK and which continues to drive it today. And the voice of carers has always been central to that movement. There's nothing more powerful than the testimony of those experiencing the impacts of caring. And it's the natural complement to the power of evidence that we have heard Rob talk about so eloquently. And it's at the heart of the future that Alyson described, where technology actually is people-powered. So people are at the heart of everything we do. Mary Webster herself understood the need for an evidence base to support her campaigning work, and Carers UK has stayed true to that original approach, collaborating with academic researchers over the years and growing its own portfolio of research, including its flagship annual survey, State of Caring, which last year had over 7,000 respondents. But the voice of carers, that powerful story, has remained central to everything we do. We are a membership organisation regularly in touch with nearly 40,000 carers, but we reach many more through our campaigning and media activities. We have mobilised carers, organising campaigns that have seen them write to MPs, lobby Parliament, and deliver petitions to Number 10. Over the years, we've seen carers become part of consultation and representation at local level, working with local authorities and health bodies to ensure that carers are recognised in the planning and delivery of their services. We've engaged carers directly in the process of ensuring that they're recognised in law, working on 3 separate private members' bills, before finally seeing carers' rights to recognition and support enshrined in the Care Act 2014. Most recently, we campaigned for and were successful in getting carers included in cohort 6 of the COVID-19 vaccination rollout, and in the process, critically, worked with the NHS to ensure they're registered as carers by GPs. But we have a long way to go. Our Chief Executive, Helen Walker, talked in this panel session last week about the challenges of recognising carers in society, in service provision, in the workplace, but above all, the challenges of helping carers to self-identify and to recognise themselves, the role they play, and their need for support in that role. Recognition is one of the key pillars of Carers UK's strategic direction of travel, and one of the most powerful tools we have to promote it is the voice of carers. Caring is everybody's business. I would imagine that there are very few of you listening to this session this morning who've not been touched by it in some way, providing care yourselves or knowing someone who does. However, it may be the moment that you hear someone else's caring story that lights the touch paper of your own understanding of your role or the role of someone close to you. There's a significant and growing body of research on caring, which has been demonstrated by the 3 weeks of this excellent conference. But for many, it's still the story that touches them that is the beginning of their journey. We've worked with Sue Yendall and her teams at the universities, first of Sheffield Hallam, then Leeds, and now Sheffield since 2002. And from the outset found we had the same passion for using research to make a difference. This passion has not diminished over the years, and Carers UK's collaboration in academic programmes such as Sustainable Care has, we hope, been key to bringing the voice of carers into the heart of that research. I want to use one example of that collaboration that proved to be highly effective. To mark Carers' Rights Day 2019, Carers UK launched Will I Care? The Likelihood of Being a Carer in Adult Life, which looked into the likelihood of adults providing care at some point in their life. This research report was produced in collaboration with Drs. Matt Bennett and Yinan Zhang, then at the University of Birmingham, and of course, Professor Sue Yendall, and was undertaken as part of the Sustainable Care programme. This was an academic evidence base, using a sample including individuals who participated in the British Household Panel Survey and Understanding Society Survey for more than 15 years, between 1991, 2001 for Northern Ireland, and 2018. So Matt and Yinan crunched the stats, and what we then did was tell the story. As well as topping and tailing the report with an introduction and policy recommendations and designing it with accessible infographics and carer images, we put the full weight of our media effort behind it, finding carers to talk about their own experiences of the impact of caring and targeting public media channels. Our story was that 2/3 of UK adults can expect to care for a loved one in their lifetime, which made it as likely for the average UK citizen to be a carer as to be a homeowner. That story was picked up, and we hit not only the broadsheet press, but the tabloids, and had a significant amount of both TV and radio broadcast media. we generated 146 pieces of media coverage, reaching a total audience of almost 23 million people. This excellent piece of research became a powerful story of people whose lives had been changed forever by caring, and brought the report's recommendations to the widest public. The lovely Matt Bennett contacted us from a hotel room somewhere overseas to say that he didn't think to that point that more than a handful of people had ever read his work, and now millions of people knew about it. But critically, millions of people knew that story. We've worked with Sue and the wider team throughout the Sustainable Care programme to bring carers' voices straight to its heart, and are now looking forward to working with Professor John Glasby and his colleagues as he leads Impact, the new evidence centre, which will support policy and practice in this field to ensure we do the same. At the end of the day, the sustainability of our health and care systems, and indeed the health of our societies, depends on how we recognise and support the vital contribution that carers in families and in communities make, and how we ensure that their voices are heard. Thank you.
Thank you, Madeleine. Sorry to be so long in coming to you. I don't know which button got pressed then or not. But Madeleine, you've provided an incredible overview of both the history of the carers movement, and I'm sure we'll make some efforts to relearn Mary Webster's powerful story in the years and weeks to come. But also you've brought us right up to date with where carers voice, the power of carers in policy, but also in social movements, has found its feet, and given really crisp examples of some of the ways in which carers and the carers movement has been able to influence policy and indeed sometimes practice. I thought there were tremendous connections between the three speakers that we've had. So without further ado, I think we'll look at the questions that have been coming in, and there are room for more questions if people would like to make comments on them. But I'll start with a very early question from our colleague Diane Burns from the University of Sheffield. Diane has commented particularly on Rob's presentation, saying that she very much valued his look at the power of good evidence, but asked a question about what is the role of qualitative studies, and particularly referring to her own of home care agencies, in producing what seem to be key messages that will have traction with policymakers. So they are important studies, but she's, I think, hinting that perhaps qualitative studies don't have the power of numbers, the power of big data. But I'd be interested to hearing your thoughts on that, Rob, particularly in relation to Diane's discussion point, which was a study which is of organisations, not necessarily individuals as well. So over first to Rob for that.
So thank you very much, Diane. I think the studies that you talk about clearly will have you as a privileged researcher with lots of knowledge, intimate knowledge of these organizations. And perhaps one of the things that you can be doing is sharing some of that knowledge with the different partners in the research, and also with the people that you have spoken to in each of the case studies, and getting feedback from them, not only on the story that you're able to tell, but perhaps a little on some of the ideas that you've come to from your interviews and information with the different parties about what steps might make sense to take next. So I think one part of the exercise is you making visible to the different partners in the home care provider organizations the different perspectives and what some of the implications might be. I suppose you'll be identifying different priorities and maybe also different sensitivities among the different actors involved. So yes, partly feedback to them. Secondly, I guess that you are contextualizing the work that you do probably at a local, maybe a regional or even a national level, and thinking about the relevance of the findings for different policymakers in different policy areas. And again, I think part of what you could do in preparing your messages is try out the information, but also your policy ideas with the relevant policymakers to whom you ultimately want to direct your proposals for change. And finally, my feeling is that it makes sense to focus on a smaller number of key messages rather than a lot of messages that you feel less confident about. And that's really something that could be applied across, I think, a lot of the research that we talk about.
Great, thank you, Rob. Over to you, Alyson.
Well, thank you. If I give you an example about the quality of impact during COVID, that was exactly how we got the policymakers to listen. So when I was give you the intro and I said that we did some findings during the initial stages of COVID, it was the qualitative stuff about real people and real lives and real carers that got the voice of Lord Bethel, the Secretary of State, Under Secretary of State, and his colleagues in the department to rethink, this is fabulous. So I would say carry on care, in Sheffield. We have to tell it through the eyes of the people. Yes, with quantitatives, the return on investment, the benefit realizations, but the bit that gets the hoop is the real people, as Madeleine's just described in her story. It doesn't matter whether it's a Secretary of State or we're describing that to a carer. Those real stories, real people and real outcomes are what get people listening and really engaging.
Great. So a plea there, I think, for the authenticity of the research to come through. I think we could move on to another question, and particularly our colleague from Oxford now is a colleague who has moved to Oxford, Yanan Zhang, who asked a question about the green paper or the white paper or whatever colour paper it's going to be on adult social care reform. And the question is two parts, but I'm going to turn it round to what I think might be today's topic, which is which research is urgently needed to inform the white paper, if there is any research that needs to be done, and then what's the biggest challenge to reform. But let's hear that in particular in relation to, is there anything that needs doing now? And because we know the ink is virtually dry on the paper in some respects, what would anybody want to say? Is there a massive evidence gap that needs filling immediately, or should we hold our fire and perhaps see what is being suggested and then pause for thought there? I think we'll turn to Madeleine for that, because her eye is firmly on the policy button at the moment. So what do you think, Madeleine? Is there a glaring hole in the evidence base?
I think we have enough evidence. That is not to say, Jill, that there aren't evidence gaps. Of course there are. And one of the huge benefits of sustainable care has been in identifying some of those gaps and looking at, with colleagues nationally and indeed internationally, at how we fill those. And actually, I think sustainable care has also had a good bash at filling some of those as it's gone. But we have more than we need. We really don't need to hear the story again. This is a debate we've been having for decades. And I think every single government puts it in the too difficult to do box, passes the buck, and nobody wants to take it on the chin. What we need in order to make this happen is resource. It needs money. And sadly, when it comes right down to it, we're going to end up again, I think, having a debate on how we fund social care. We absolutely need to talk about how we deliver social care. Alyson's, technology-enabled care services are such a critical part of that, but we never get there because we only ever talk about how we fund it. So we have got to be brave and bold enough to actually look finally at how much resource we are going to need to go into the future with a sustainable social care system, and a social care system which has the same, equity of esteem as our national health system. Everyone out there clapping for carers, banging the big drums in COVID, and a national health service which is seen, absolutely as fundamental to equality of access in our society. Social care, I do not think the story of most people's experience of social care would be on that same page.
Mm-hmm. So over to you, Rob. Is part of the problem then that social care is just so amorphous that it's everything and nothing? And I know internationally social care isn't always the term used. Have we got it right in talking about social care?
Well, my first comment was going to be that we talk a lot about social care in the UK, and we talk a lot less about it in very many of the EU member states. And just not to contradict Madeleine, but there's a fairly fundamental need across the EU, where I have a particular interest, in establishing numbers, characteristics, difficulties, and methods to improve lives of carers and the people that they care for. So I'm very concerned that we put together an agenda that's relevant at an international level. I'm sorry to say, especially if Stacey from Eurocarers is listening to this, that I'm quite dismayed by the new green paper that the Commission is discussing in Europe. It starts by talking about informal care and the demise of informal care and how people won't be able to provide family care in future because of employment, mobility, and so on and so forth. And you do despair, you feel discouraged because they're not paying attention to the research in Europe, which shows you as evidently as it does in the UK, that more and more people are providing care. More and more people are, in one way or another, combining work with care. And they are not attacking or addressing the key agenda for policy if they think in terms of either or, because the either that's called formal care just isn't going to happen across most member states. And the questions for policymakers must be much more nuanced than only can we develop long-term care services. So I think research has a massive role to play still in identifying the issues, in possibly identifying solutions, but in moving the agenda forward, in Europe at least, even if it's already well established in the UK.
Thank you, Rob, for drawing a gaze beyond our own UK and indeed English navel. Alyson, anything you would like to add about a particular research gap that you've identified that could be urgently filled, or is it really, are we in there for the long game and the long term?
I think I agree, with Madeleine, there's lots and lots of research, but going back to what Rob's saying is in Europe, when we did our recent piece of work with Rafa Bengoa is an international global support of technology and how we can change social care. And he referred to the Danes. He said, which I'm going to read, I found it while you've been speaking, live your life at home is what they are calling their new social care movement. Now, this is really quite compelling. But what he did say was in the UK that Europe and further afield have got a lot to learn from what we do in terms of strategic thinking and policy making. Come on, let's get this personalisation agenda off the ground. I agree with Madeleine. The researchy bits is more engagement. I think it's engagement with service users, which we've seen. I think that bit of it maybe needs to be enhanced a little bit. So the service user and their carers and what the real life experience is. But for me, give us some money. Welsh Government launched 100 million at our conference for the reform of social care. to rebuild back better? What about England? Where do we get that money to help us to drive this agenda forward for personalisation? Come on, we have to keep shouting.
Thank you, Alyson. That's a very interesting. Very, very interesting, and I think we have a lot to learn about some very basic facts that sometimes people misinterpret. And Madeleine drew attention to the likelihood of caring. There's also the question that most people in England, it appears, still think that social care is paid for by the NHS. And indeed, a disturbing number of people think that most older people are looked after in old people's homes. It never fails to amaze me that people massively overestimate the likelihood that people will be in care homes, and indeed this current population there. And probably will be perhaps even extenuated by, or no, will be bigger because people have seen a lot of care homes on the TV recently in the past year. I think that hopefully answers some of the questions about is more research needed, which of course is a piece of string if ever there was one. I'm going to turn to another question now, which is about from our colleague Katia, which says that there are presentations have shown how much science has contributed to the development and visibility of carers. We as scientists have got an important role in transferring findings to policy and society. But how can we do that? How can we make sure that our findings move to policymakers, but also to the wider public? Madeleine's given very good examples there about making things newsworthy. Alyson too has talked about the potential for working together and much more in collaboration with people and drawing politicians into that space as well. And then Rob has raised our horizons to talk about thinking more internationally in order to spark off ideas with people, but also to assist them on the journey that the UK has been on with carers for so many decades. But perhaps one example from each of how perhaps a piece of science, scientific research, science, speaking broadly, successfully transferred into either policy making or society. So perhaps Madeleine could take that question and give another example of a successful idea, small or large, that really changed people's thinking, if indeed there has been one.
I think there has. And I have to say, I think sustainable care is a really brilliant example of a programme that was predicated on the need for the research it did to make a difference. So that's the start. If we want to bring, if we say that science is the robust academic evidence base in whatever field, and that's what we want to bring to bear, it's understanding what it actually means for people and how it's going to make a difference. And who you target in order to make that difference. And sometimes that's a very long game. So at Carers UK, we have played a long game over the years of constantly working, if you like, as a critical friend to the government of the day and opposition. We are non-partisan to ensure that fact underlies the experience of the people who we represent, and we wouldn't have been anywhere near as successful as we have without the absolute power of evidence. So I think, in terms of the current work we're doing, the campaign for the introduction of paid care leave has been based on a tremendous amount of research in the field on carers and employment. Sue and her team, in 2004, undertook the biggest survey ever of the impact of caring on work and the experiences of carers. And there have been many people doing excellent work in that field, including Jason Hayes as part of sustainable care. We continue alongside that to survey work with our Employers for Carers members to actually get the experience of employers and bring that to bear, because that's a very powerful voice. And we're not going to call it lobbying, because actually in real life we're not allowed to do that anymore, but we have used that that interest and the feelings of those employers to bring to bear the kinds of policies that we've called for. If you'd asked me 20 years ago at the launch of the Work-Life Balance campaign in 2000, which didn't have carers on the horizon anywhere, that we would be seeing in 2020 a call for statutory care leave for carers. I'd have said you were mad, but here it is. So I don't think we should ever lose sight of the intense power of the collaboration of researchers with people with a real interest in creating change in policy and practice. And I think it can achieve real success.
That's fantastic. And Rob, over to you.
Maybe two examples. I think one is at the European level, which is to say that family carers, I think, were very far from the European agenda, certainly 10 years ago. But once the civil servants, the officials, began to get some understanding of the role and contribution of family carers, they moved onto the agenda quite quickly. And there was an awareness that carers were an issue to be addressed not only in relation to health and social care, but also around, for example, employment and the implications for work. And some of those concerns around the aging population and the financing of care have been more powerful in leveraging the interests of carers higher on the policy agenda. And Madeleine just quoted carers leave. Who would have believed 5 years ago that carers leave would have reached the level of a European Union legislative initiative already last year. Then on the communication between science and policy, I think it's just to say that obviously this is not just an issue affecting researchers in relation to care. Across the whole spectrum of social research, there are agonies about ensuring the take-up, the listening to the messages coming from research. And in Ireland, to give a recent example, we've had a lot of discussion recently regarding the relationship between science and public policy. And it's understood that politicians, but also policymakers, i.e. civil servants, are critical and need to value the research. But so too, researchers need to understand and value what policymakers do and how difficult policymaking is. Science Foundation Ireland has just begun a program of what they are calling public service fellowships to give researchers a period of, I think, 3 to 6 months in government departments, or at least in policy-making departments, maybe also at the local level, to increase their understanding of what's involved and the challenges facing policymakers. And I think this is part of the more general need to improve communication, dialogue, debate between policymakers and researchers, which can only be to the advantage, not only of researchers, but ultimately of the well-being of carers and their families.
Yes, thank you for that, Rob. And I think the influence of terms like social dialogue in Europe is coming into the UK a lot more. I'm going to just move that question slightly differently to Alyson because time is pressing. And just to say, with that in mind, Alyson, that what we've been talking about, which is that connectivity, there's a question from Kate Hamblin here about specifically to you, saying, how do we communicate evidence to a very broad range of stakeholders who are at massively different stages of the journey in terms of digital technology and so on, particularly evidence that's trying to focus on well-being outcomes. So if you maybe can kick that one around for us. If you can answer a question with the answer is 57, well, that's fantastic. But I think a bit more discursive than that.
I think going back to Kate and work really closely with Kate, and I'm quite excited at the new initiatives we're going to be working with Sheffield. I think go back for me If I think about a carer in the community, if I think about my brother-in-law, who's the main carer for my dad, if I think about how we influence Lord Bethel, for me, we need to take some of the research, make it simple, and storytell. Storytell on every different level. Because if you want to influence my brother-in-law in the community who finds it really difficult, and then you want to influence at a policy level, and like in Newcastle, they've got initiatives like Collaborative Newcastle. I'm going on a call next to really start looking at how they do that. One of the things they're saying is creating families to have an identified partner. Oh my goodness, that would be game-changing, wouldn't it, in communities? So for me, great, Sheffield, let's start working with some of the evidence you have, which is rich. That how do we turn that into the story so it hits every single level of everybody that has impact on those people in the communities and our caring communities. The only way we're going to do the technology shift, only way.
Yes, and indeed researchers have got such a power to play in all of those debates, haven't they, about giving evidence. I also think that the researchers have done a fantastic job in not letting certain hares run. Rob and Madeleine and others will probably know that there's always been a little interest in the media on granny dumping. And I think researchers have been very responsible in saying, we don't have the evidence on that. It doesn't appear to be a problem. It's not a term we would use. It's disrespectful to people's lives. And I think we've kept that a much less emotive and less blamey culture than it could have been by saying that research is not about this area. There are many other things we will discuss in a way which reflects our own values. And I suppose values have been something that we've touched on implicitly throughout this debate today. So we've got to, I think we'll just now start to wind up and say if people have got any closing comments. Alyson, I know you've indicated that Newcastle is calling you, so we'll probably start with Alyson and then move to Rob and Madeleine there. So Alyson, thank you so much for joining us. Some last thoughts if you have anything that is a sort of take-home message.
I think for me, and I think I would like to speak not as in my role as on a national role. I want to speak as a carer, an informed carer. I have my mum here today on respite because she fell last week, as we have a 24-hour service for my dad in his home. He's happy. He's very happy. Just keep doing what we're doing, Sheffield. Keep doing what you're doing, because you make a real difference. And we've got a long way to go. You make a real difference in my life as a working informal carer. So thank you. And I love working with the university. So upwards and onwards, we'll keep battling and make sure our policymakers and our delivery functions locally start to listen to what we have to say. Thank you.
Thank you, Alyson. Over to you, Rob. A take-home message then, or a question you'd like to pose for everybody to take home with them.
Well, I think I should have said more about the role of intermediary organisations, or, of course, I mean to include their advocacy organisations in the first place. I think that we've heard a lot about Carers UK, but there's some similar sorts of stories for Family Carers Ireland. There are, at the European level, the role of Euro Carers. There's a very important role of these organisations in not translating, but in helping to make visible the results of research to relevant policy and practice organisations. Secondly, I am constantly aware of the diverse numbers and types of worker who contribute to the lives of carers and people being cared for. And I think that a particular role goes to primary healthcare, the doctors, nurses, and staff working at the local level, and that we need to do more, I think, to support their contribution to improving quality of life for carers. And part of that is, again, by making visible what it is that carers are doing. So I think research has a contribution to make there. I was quite amused earlier when somebody made reference to Denmark, because in the early days, in 1993, when we started doing research in the member states, we were advised, don't bother going to Denmark because of the well-developed long-term care system there. And of course, when we went, we found hundreds, thousands of carers, people who were still doing the bulk of the care work quietly in their homes, whose lives were invisible, shall we say, to the policy audience. And part of the role of research was clearly in making their lives and the challenges they faced more visible. Last point, and I hope this relates to something Madeleine might say. As I said, we've been reading since the 1980s, and maybe before, about the need to recognise the contribution, the work of carers. And you might say that lip service has been paid to the contribution of carers for so many years since. And what really is important is to work together with the intermediary organisations, the advocacy organisations, the community organisations, and the policy makers to ensure that we translate that recognition into action in support of dependent people and their carers. So, my concluding point.
Thank you, Rob. That's really important. I think so much for those of us who are in the research world is being members of these organisations and just hearing how they're managing on a more regular basis rather than an instrumental basis, which is, please, would you like to come and support my research study? So over to Madeleine then for thoughts and contributions and maybe some take-home messages for people. I'm going to take chair's privilege and just ask Madeleine also to comment on people who don't have any family. They may well, of course, have got fabulous friends and neighbours and everything, but I think also coming up the policy agenda through COVID was that group of people for whom either they've outlived family members and family and friends, and the role of society and sociability in working with these individuals too, of whatever age.
If I take that point first, Jill, I think it is an issue, and we know it's going to be an issue into the future as more and more people opt, not to have families, and as people live longer, they're very often living their older lives alone, and it makes the whole issue of how we formalise, recognise, embed in our society social care. There has to be a service that responds. We would expect health to respond. So if that person on their own, had a health crisis, we would expect the service to respond. There has to be something that responds. We've got to have that wraparound. I think that we have seen an extraordinary outpouring of community support in COVID, and I would hope that we can continue to tap into that. I think that communities, if they are enabled, very often if they're organised, and we've seen that was also an issue in COVID. How do you take that and harness it and make it go in the right direction? They have a massive amount to contribute, and we should always try to ensure that individuals who are living alone do not lead lonely lives. Because you live alone does not mean you have to be lonely. You can be connected. Technology has a part to play there. So I think acknowledging that aloneness is fine, but you want to be an integral part of communities is one thing, and then acknowledging that we must have a social care system that is as responsive as our health service, and that we take for granted in the same way. So I think that's absolutely critical. The other point I'd like to make is really to build on something that Rob has said. You're absolutely right, Rob, about the role of advocacy organisations. Ours is just one, and we're just one player among many, and it's been one of my huge privileges over the years to work with many others. In Europe, we were there, if you like, at the birth of Euro Carers, and it's been one of the most extraordinary experiences to share that the policy landscape in different countries, to understand exactly how different systems contribute to the quality of people's lives. Nothing I've ever heard, either from Eurocarers, from the International Alliance of Carers organisations, has ever led me to believe that the challenges facing carers are not common. So, you know, health infrastructures, care infrastructures, insurance infrastructures, of course, vary so hugely across the world, but actually the fundamental experience of a carer in India can be the same as the fundamental experience of a carer in the UK or a carer in Ireland. And I think it's understanding those common challenges is absolutely critically important. But I'm with you, Rob. It's about how we bring these organisations together. So for me, the whole excitement of the panel, the power of evidence, the power of technology, the power of the carer's voice, it's about the power of collaboration. Because if we bring those together, if we understand that there is that we need to have that inbuilt interactivity, any research program must look at policy, that campaigning has to be based on sound and robust evidence. If we accept that, and if we identify key organisations who can work together in this way, and if we collaborate on that basis, I think we have very, very, very powerful tools to create change.
Great. Thank you so much, Madeleine. And you too, Rob, for an incredibly interesting and stimulating debate. We're going to stop now. We're going to pay our huge respect to Madeleine's cat, who has listened intently to the debate and never made a move. So thank you, Madeleine, and your cat. We're going to thank Rob particularly for his contribution today, but also for chairing a very proactive and encouraging advisory group. We're going to thank everybody who's asked questions, some of which have been merged together. So if I haven't named you, that's because I've wrapped the questions up in a bundle. And as always on an event like that, I'm going to thank our IT staff and Kelly from the Sustainable Care Programme for all her efforts in getting this to be such a successful and really stimulating start for the week. Please join us later for the other events today, including, of course, Joan Tronto's presentation, which I know will be a landmark for us all in hearing directly from somebody who's really helped us think through caring, care work, and so on. And I wish everybody a very good afternoon, and over to you to go and have what would be a conference lunch, but unfortunately is not. But our thoughts are with everybody, and the sociability that usually goes with lunch is much missed. So have a good afternoon, everybody.
Thank you, Jill.
Thank you again, panel.
Thank you, Jill.
Thanks, Madeleine.